Hello, welcome everyone. I am very excited to see you back this week. Today, I'd like to talk about a condition called Polymyalgia Rheumatica, or PMR for short. And I really like to take feedback from my patients and people watching my videos. And I saw quite a few patients this week for follow-up and even new diagnosis of PMR. So I thought it would be really nice to highlight what that condition is, what that acronym or polymyalgia rheumatica means, and talk a little bit about the way that I treat patients in my practice. So if you are over the age of 50, this video is for you. If you know someone over the age of 50, this can be helpful because sometimes it's one of these conditions or diagnoses that is a little bit tricky to figure out. Patients will often start their journey complaining of joint pain, for example, or neck stiffness, or a hard time reaching up, grabbing something off of a shelf or a cabinet, or washing their hair becomes more difficult. And this condition can progress to involve the hips and thighs. It can start to travel down the extremities and affect the arms and sometimes the hands, but it can be neck pain as well. And what this is ultimately is not specifically an arthritis. It's not inflammation inside of our joints, the way that rheumatoid arthritis causes swelling, but it's a bursitis and tendinitis that actually causes inflammation of the supporting structure around the joints and the tendons. And so imaging, like an MRI, for example, can show someone with tendinitis. And it typically is bilateral, meaning both sides, affected fairly equally. It doesn't always start off that way, but as it progresses, the inflammation travels to both sides. And for most people, it involves both the shoulders and the hips, or at some point affects those. And we call those girdle muscles or girdle joints. So the girdle muscles of the shoulders and the hips are affected. And this involves often dramatic, but it could also be mild elevation of inflammatory markers that we can measure by a blood draw called sedimentation rate, or ESR, and C-reactive protein called CRP. So if you're a patient who says, oh my gosh, this sounds like something that I have, I really encourage you to try to talk with your primary to get those labs ordered, because if they're abnormal, that really gives us a clue that this is something that we're talking about or considering. If they're normal, you can still have polymyalgia rheumatica, but it's just less likely to be the culprit or the cause of your joint stiffness. Most often, this condition progresses very quickly, but for some people it can happen slowly over time. Usually we'll hear a story similar to somebody who's very active, right? You're hiking, you're biking, you're doing all the things, you're chasing after your grandkids, and something changes. Something happens that it makes it hard for you to get out of bed. All of a sudden, one day, things change. And then over time, other symptoms start happening, right? It might be neck stiffness that you start off with. Maybe I slept a little weird, have a kink in my neck, but over the course of time, it progresses. And it doesn't typically improve with Tylenol, ibuprofen, Aleve, even pain medications. People can be on opioid prescriptions and don't have any improvement in symptoms. The magic for PMR is prednisone or steroids. And if you watched back a few videos ago, I talked about prednisone and some of the things that we have to watch out for when we use prednisone. For polymyalgia rheumatica, in my practice specifically, I often will start patients at 10 or 15 milligrams a day of prednisone. And within 3 to 5 days, I'd like to see at least 50% improvement in symptoms. So if you're feeling at least 50% better with a very low dose, moderate dose of prednisone, like 10 or 15 milligrams a day, and have elevated sedimentation rate, and C-reactive protein, then we know we're on the right track. We know that we've found our diagnosis. And that's often all it takes, is just a little smidge of prednisone. But the trick is how we then taper the prednisone, what we do after you start to feel better. And that's where rheumatologists really come into play, is that we have to taper the prednisone slowly over time. We all do it a little bit different. We all have a little bit different process for this. And that process can change over time. It can change as you respond or as you progress through your diagnosis. So there's definitely no one size fits all when it comes to prednisone and tapering prednisone, but that is the medication that we use to treat polymyalgia rheumatica. One thing that I'd like to really emphasize is that PMR can be a syndrome that also encompasses something called giant cell arteritis, or GCA. And that condition can coexist with stiffness in the shoulders and in the hips, but it's inflammation of the blood vessels that supply our eyes. And so if you're somebody who has stiffness, like we talked about, in the shoulders and the hips, but you're also experiencing new or worsening headaches that are different than any kind of headache you've ever had before, particularly around the side of your eye or your temple area. If you have pain in your jaw or tongue with chewing, so all of a sudden eating meat becomes difficult for you because that's painful, or if you stop chewing gum, if you're a gum chewer, because it just feels sore, that's a concerning sign. That can mean that you have inflammation of the blood vessels along the temporal artery. Also, we look for inflammation in the optic blood vessels supplying our vision. So if you have any changes in your vision, if you have blurry vision, if you notice that you're having shades come across, blackening vision, you're losing vision, that's actually an emergency and requires you to go to the nearest emergency room as soon as possible. And that's because we call that threatened loss of vision, meaning you have inflammation in the blood vessels that are causing essentially mini strokes or blockage of the blood flow to your eye, and you can actually go blind from this. So it is a condition that's considered an emergency if that happens. We don't want that to happen. So during your visit, when you talk about your symptoms of polymyalgia rheumatica, we definitely want to know if you're having any headache, blurry vision. Sometimes people can even feel scalp tenderness, where they're brushing their hair, washing their hair, and they feel really tender. It just feels like their scalp is either itchy or tingly or on fire. That can kind of go along with it as well. So there's a great handout or explanation of this at the American College of Rheumatology website. If these symptoms sound like something that you're experiencing, I encourage you to seek medical attention right away. Again, I don't provide specific medical advice on my videos, but when we talk about things that are really concerning that you seek medical treatment for, changes in your vision are a big one that should be emergent. But otherwise, like I mentioned, we can start with your primary and get basic blood work. But if you notice that symptoms are progressing, and they can progress fairly rapidly, getting to the point that it's hard to get dressed, you're having a hard time doing your daily activities, you're not able to cook or clean or do basic household chores anymore. If it's really hard for you to get up from a seated position, particularly without really pushing yourself up, those are reasons to seek medical care. And the good news is that this is treatable, right? This is something that it takes just a little smidgen of prednisone to treat. But the trick again is that we use that prednisone over a longer period of time. And so specialists like rheumatologists are very comfortable managing steroid treatment over a long period of time for that specific reason. So hopefully this helps someone out there identify some of their symptoms. For my patients who see me for this condition, I applaud you because, once you're feeling better, the goal is to get you back to your activity, get you back to living your life and feeling better. And we really want to help people get there as quickly as possible. And then, like all of my other videos, if you're not having these conversations with your doctor or healthcare team, I really encourage you to speak your mind. Tell them that you're not getting better with the treatment that they have proposed or that you're working on. Or again, go back to that video about steroids. And if you're having side effects that feel negative in any way, bring that up. It's so important to discuss those things. So I hope that you enjoyed this and got some information to spread the word. Again, tell your friends, anybody that you feel like has some of these symptoms. We don't typically diagnose PMR in patients younger than 50, but if you're 49 and almost 50, you're close enough, right? We can still consider it. But the magic age for this is typically 50 and above. And we don't know why it happens. We don't know where it comes from. So again, it just comes out of nowhere. It comes on pretty quickly. So if this sounds like something you're experiencing, definitely look for your closest rheumatologist. And if you're in the Phoenix area, look me up. You can find me online. I'm happy to have you as a patient. So thank you for joining me today and spread the word. Talk to you later. Bye-bye.